we're going to begin with Dr. Pierucci. Dr. Pierucci is a clinical neonatologist and a neonatal intensive care unit director at Bronson Medical Hospital. We're glad you're here, and you have 5 minutes. Thank you.
Mr. Chairman, ranking member, and members of the committee, I am here today because as a neonatologist, my job is to care for babies. After 20 years of practice in a 50-bed neonatal intensive care unit, I can state that if born alive, all babies should be cared for. The Neonatal Resuscitation Program, or NRP, provides a consistent research-informed guideline for how to help a newborn baby transition from intrauterine to extrauterine life. Clearly, the more premature a baby is at birth, the more at risk they are for requiring significant help making this transition. However, the NRP's algorithms are specifically designed to guide neonatal teams' assessment and intervention for even our sickest and smallest babies. NRP defines the medical standard of care that all live-born newborns are to receive. It also defines the standard of care that the medical staff are responsible for providing. The NICU I work in is the regional referral center for our area, and we have a transport team, which is deployed whenever we are called about a baby who is too ill for the services available where he or she is born. Well, studies have demonstrated that extremely premature babies have better outcomes when born in a facility that routinely cares for their unique needs. We and other NICUs with transport programs throughout this country successfully transport babies into our units every day. Emergencies happen. That's just one reason why we in the NICU and all critical care responders exist. No one guarantees the outcome. All of us guarantee that we will show up when called. This is the medical standard of care for all physicians, and we promise to apply it consistently to every human being. There is no ethical reason why this medical standard of care should be abandoned for a subgroup of people because they might be less wanted than others. Wantedness does not determine humanness. Put another way, it would be an abandonment of my medical and ethical duty if I only respond to the needs of some babies and not to others. While it is always my duty to care for every baby, this does not mean every baby should be resuscitated. Exactly like patients seen by most other doctors, there are patients that are beyond our ability to heal. The NRP acknowledges this, stating, the birth of extremely premature babies and those with significant chromosomal abnormalities raise difficult questions about resuscitation. Each situation is unique, and the decision-making should be individualized. The point is, a living baby is a real patient, and just like every other patient, newborns need to be both skillfully and compassionately evaluated, just like every other living patient. There have been times over the years when a baby was dying and the parent was not able to be present. It is at those times that I have had the privilege of taking those impossibly tiny hands into my own and simply holding the little one for the duration of his or her life. Mother Teresa stunned the entire world by picking up dying, disregarded people from the gutters of Calcutta and tending to them whether or not they could be cured. We too should never allow a baby, especially a baby, to die anywhere but in the warmth of our arms, nestled securely against our hearts. So, ladies and gentlemen, a newborn's first and primary diagnosis is it's a baby. All the other diagnoses, prematurity, respiratory distress, sepsis, pick one, are secondary, and they never negate the first one. Because of their primary diagnosis, human baby, whether or not we have the ability to heal, we are always obligated to care. This means that all human babies who are born alive are our patients, and medical personnel should be ready to directly provide the medical standard of care or be prepared to stabilize the baby until a team with more advanced training arrives. I offer this testimony in the hope that by consistently caring for all babies, we will simultaneously also better care for their mothers, which will extend to an entire tree of affected loved ones. This remains my privilege to do. Thank you.
Thank you, Dr. Pierucci.